At the rally. Were you at the rally too? Yeah, so the rally and the hearing you did. Yeah, just a little small. Yeah, that was a little. Yeah, no, you give it to.
No, I think
Did you give her your info?
well, they have it. Yeah, I think
No, what I'm saying is the email to the director, so that she can send it to you, so she coordinates on the faith-based initiative, the money for it. She what's happening, I really wish there has to be some research done on it, because what's happening is a lot of people are leaving lines, they can get treatment.
Get started. We were and continue to await the arrival of our deputy majority leader, Councilwoman Inez Dickens, but she is caught up in traffic right now. But I am here with Councilmember Jamani B. Williams of the 45th District of Brooklyn, and he is also co-chair of the City Council of the Black, Latino, Asian Caucus. And also Councilwoman Melissa Mock Villarito of the 8th District here in Manhattan. And also co-vice chair. Oh, okay, we have two co-vice chairs here. Thank you so much. Of the Black, Latino, and Asian Caucus. And I think to get started, Councilmember Jamani was going to make a comment. I'll comment, and Councilwoman Villarito will comment, and maybe by that time our deputy will turn to you.
Thank you, Ms. Fields. It's definitely a pleasure to be here. Thanks everyone for being here. This is obviously it's a 30-year anniversary, somber on some points and good on others. We have a lot of information that we didn't have 30 years ago, and an 11-year anniversary for the National Black Leadership Commission on AIDS. It's very important to make sure that we continue this conversation. And my district in Flatbush probably has the second or third highest AIDS rates in the city. It's extremely important. And of course, my district is also heavily Caribbean. And I just implore the Black community, Latino community, Caribbean community, and of course our faith-based initiatives to really, we have to take our head out of the sand. Sometimes I think we try to turn a blind eye to what's going on with AIDS. We try to throw a blind eye to homosexuality in our districts and in our communities. I think it's time that we really step up and take our heads out of the sand, because it's making the situation worse. And I think the only way to make it better is to make everyone feel okay, to be who they are, and talk about what's going on with them, talk about AIDS in general, so that people can begin to get the treatment that they need, and so that stigmas can come down, so our communities can get better. So I think the message to me on the 30th anniversary, we have enough ideas, we have enough information, we have enough understanding, we have enough ways to prevent this if we really just begin to take our head out of the sand and understand these things and everything that's going on in our communities. Also, except it's hitting us much, much worse. So I'm so thankful for the leadership of Ms. Fields, of the commission, and everyone that's here. This
Thank you so much, Councilmember Williams, and I am Sue Virginia Fields, former city council member, former president of the Borough of Manhattan, and now president of the National Black Leadership Commission on AIDS, which is the oldest and largest nonprofit in the country that is focused now for 24 years on addressing HIV/AIDS in the African American community and working with the Latino Commission on AIDS because of the growing impact certainly in the Latino community. And today, ladies and gentlemen, we're here to commemorate the 11th anniversary observance of the National Black HIV/AIDS Awareness Day, February 7th. This is a day that was set aside 10 years ago, 11 now, in recognition of the disproportionate impact of HIV/AIDS on African Americans nationwide. This year also, as the council member mentioned, marks the 30th anniversary since HIV/AIDS was first reported by the National Centers for Disease Control and Prevention. And this is why the National Black Leadership Commission on AIDS, in partnership with the New York City Council, the Black, Latino, Asian caucus, chose this date and this year to officially launch what we call our 30 years strong We Will Win campaign, where we will chronicle 3 decades of living in the shadow of HIV/AIDS in the United States. Under the umbrella of the 30 years strong Together We Will Win campaign, the National Black Leadership on AIDS, Commission on AIDS, will engage in a year-long series of programs and activities to re-engage the public, to heighten awareness about the continuing devastating impact of HIV/AIDS among African Americans and Latinos here in the United States, and to advocate for change. The 30 years long, strong Together We Will Win campaign specifically will promote 7 key areas. 1, sharing personal stories of courage and loss for those infected and affected by HIV/AIDS during the past 3 decades. This initial phase of the campaign will feature an online commemorative journal on the Leadership Commission's website, www.nblca.org, where the public will be encouraged to share their stories, photos, and videos about how HIV/AIDS has impacted their lives and the lives of their loved ones who have passed on. 2, HIV testing for at-risk population and linkage to treatment and care. The Center for Disease Control estimates that there are 1.1 million Americans living with HIV, and as many as 25% of them do not even know this. So among those Americans who are estimated to be living with HIV, more than 500,000 are Black. 3, the campaign promotes expanded use of social media through targeted outreach and collaborations with online dating companies and social network gatherings. Expanded capacity building training for local community-based organizations and faith-based institutions, especially in high prevalence areas. We heard the council member talk about his own district. That has been identified as a high prevalence area. We are redoubling, if you will, our efforts in working with the councilman in that community. 5, expanded efforts among faith leaders in HIV/AIDS prevention, treatment, and care, with a heightened focus on reducing stigma and discrimination. Throughout the Black and Latino community, we know the voices of our faith leaders are very powerful. They have a tremendous amount of influence. So we want them to be be the leaders in helping to reduce stigma and discrimination by talking about it boldly from their pulpits and going out into the communities with this message. 6, the campaign promotes greater collaboration among civic, fraternal, and community organizations so that we can better maximize the resources and develop local responses to policy and budget concerns for all of us to be more active. This includes implementing age-appropriate, science-based health curricula in our public schools to address HIV/AIDS and other forms of sexually transmitted infections. Unfortunately, statistical data on rates of HIV and other sexually transmitted infections among teens reveal that many young people are engaging in risky sexual behavior. And 7, the campaign promotes increased public advocacy on key policy issues and the allocation of budgetary resources to meet the needs of the most vulnerable populations at the federal, the state, and the local levels, which includes support of research in order to find a cure for HIV/AIDS. We need vaccines. Over 30 years now, HIV/AIDS must be addressed. The many stories and voices of those posted in Blacker's National Black Leadership Commission on AIDS commemorative journal will become an integral part of the Leadership Commission's expanded policy and advocacy work to put the focus back on the people who are most impacted by the epidemic so that all Americans can see and hear the toll that HIV and AIDS continue to have in the United States on those who are living with the disease as well as their families and the larger community. So one might ask, why now? Why this campaign? Well, for us, it's a rather simple answer. Now, because today, 30 years into this epidemic, every 9.5 minutes, someone new is infected with HIV/AIDS here in the United States. Now, because of the growing complacency that we're seeing among media, public policy, and budget decision makers, as well as the general public about an AIDS epidemic that is now 30 years old, for which there is still no cure. Now, because despite the great progress made in the fight against HIV/AIDS since 1981, African Americans still have the highest rates of HIV infections, AIDS cases, and AIDS-related death in the United States. According briefly based on some statistics in 2008 from the Center for Disease Control, African Americans, although only represent 12% of the national population, account for 48% of the new AIDS diagnoses and an estimated 45% of new HIV infection cases. And the epidemiological data right here in New York City from the New York City Department of Health and Mental Health paint a similar portrait, revealing that 51% of new AIDS diagnoses, 50% of new HIV infection cases, and 52% of AIDS-related deaths in New York City as of 2008 were among Black New Yorkers. So these alarming statistics clearly paint a picture that the nation's HIV/AIDS public health crisis is far from over, especially as it relates to African Americans. So now is the time that we must sound the alarm even louder and clearer about the nation's HIV/AIDS crisis 30 years later, and what we must all do in order to bring about a change. So to participate in the 30 Years Strong Together We Will Win campaign. We invite everyone to please visit our website at www.nblca.org. Through this campaign, the National Black Leadership Commission on AIDS has indeed opened an exciting new chapter in its fight against HIV/AIDS. And with this collective voice and strength, we will fight to remove stigma, fight to end discrimination, fight to end violence, fight for more funding, and fight for universal access to treatment and care, because together we are strong and together we will win. We remain on the front lines of this war, and we urge you to join us. That's why I am so grateful and thankful to the Black, Latino, and Asian caucus of this City Council for their continuing support through grants made available in order to facilitate the work of the National Black Leadership Commission on AIDS and other faith-based institutions and community-based organizations throughout the city. I want to certainly thank our Assistant Majority Leader, Inez Dickens, from the 9th Council District, who's my councilwoman, for her steadfast leadership, and hopefully she will join us before we conclude. But I also want to acknowledge Speaker Christine Quinn, who could not be with us today because, as you know, she is in Albany fighting the good battle on behalf of this city with respect to budget. And Councilman Al Van, a founding member of the National Black Leadership Commission on AIDS, is represented here by his staff, Mandela Jones, and we want to thank him also. Both of them have been staunch supporters and leaders in this fight. I thank all of the council members, as I said, who are present here, and now we're going to hear from our councilwoman, Melissa Mark Villarito, in terms of her support and the work that she continues to do.
Council Member and Borough President Fields, I really want to commend you on your leadership, and also on what you have laid out is the course of action for the next year. Now, I, as council member, am not here just because I'm co-vice chair of the Black Latino Asian Caucus. I'm not here because I represent a district that has one of the highest rates of infection in the city of New York. I'm not here because, as a Puerto Rican, I'm very concerned about the high rate of infection on my homeland. I'm here because we are one New York City. I am here because we have to raise the alarm, and we have to make sure that we do not, are not complacent as communities, as leaders, and as a city. And so we have to continue. This is an issue that is very much a priority for me personally, the way it impacts lives, and because it is preventable in a way that we can educate and continue to bring the resources to our communities to make sure that people have the right information to prevent infection, and to make sure that those that are infected receive the services and the support and the medicines that are important to prolong their life and to continue to be positive, contributing members of our communities. So this is a very important action plan that has been laid out. It also is something that obviously as a council we are committed to through the initiative of the faith-based initiative that we fund. The National Latino Commission on AIDS is doing the work in the Latino communities throughout New York City in tandem with the commission, the Black Commission on AIDS. And so we got to ensure that we understand that the only way that we're going to be effective in this battle is that we have to unite across communities. We have to unite through community members, nonprofit organizations, our faith-based leaders, our political leaders. That is the way that we will really make a dent and make inroads on this. So I really want to thank all of you for what you do. I know there's a lot of organizations that are represented here as well, so thank you for the work that you do throughout the communities, and you can continue to count on our support.
Thank you so much, Councilwoman. And I, too, want to thank and acknowledge the presence of our representatives of local government, civic organizations, community-based organizations, corporations, houses of worship, as well as advocates and activists who have joined us for their hard work and dedication to the fight against AIDS. I understand that Lynette will make a statement on behalf of Councilwoman Inez Dickens, and then we will open up for questions.
Good afternoon. I apologize, and the council member sends her apologies. She's actually stuck in traffic. But what she wanted to do was to echo the thoughts about the children. She is very concerned about the rise of HIV/AIDS among children, among our young people. And she's urging everybody to get tested. She's urging everybody to get treated. And of course, she also wanted to express her thanks to C. Virginia Fields, also to Congressman Rangel, because the National Black Leadership Commission on AIDS is the oldest organization, black organization, to thank them for fighting for getting access to people of color, blacks and Latinos, people that were disenfranchised because of economic conditions, and they weren't able to get into clinical trials. And she also wants to thank, of course, Speaker Quinn for continuing the fight, and she pledges to you to continue to fight for funding, for research, and of course, for a cure in our lifetime.
Thank you. Are there any questions for the councilwoman or myself? And she's absolutely correct. As we work together, the National Black Leadership Commission on AIDS with the National Latino Commission on AIDS, and we have our hands on the pulse here in this city in order to implement programs and activities to have a real impact. So we hope that when we stand here in 2012, we will show impact. In October, or is it September, that we commemorate the National Latino AIDS Awareness Day. That year after that, we want to show impact. And as we show impact here in New York City, it will be felt throughout the country. Are there any questions?
This is a national or a New York City? It's a national campaign.
It's a national campaign, okay. Yes.
So can you talk a little bit more just about why you decided that you wanted the personal stories to be told and you're asking people to tell those on the web?
Because this is all about people. How this disease, again, 30 years, has impacted their lives, their families, and that has gotten lost somewhat. And as we go on Capitol Hill or come here to City Hall and the state houses around the country, we want the faces of those who are still struggling, of those who are still not receiving the care that is needed. That has to be the face of the arguments for policy changes and funding. Some of you probably have been following what many of us, of course, in the field know, known as ADAP, the AIDS Drug Assistance Program. Now, in about 35 or more states now, there are people who depend on these drugs to sustain their lives, but because of cuts in budgets at state levels, these people are put on waiting lists, or they're not being provided the antiretroviral drugs, treatments that sustains them and improves their lives. Now that's unacceptable. Over 6,000 or so people across this country are not able to get the treatment they need because of budget cuts. And as we show the faces and make the case in Washington and at state houses and city halls across the country, that is why we think their stories are much more powerful than anything that we can say. People expect us to be leaders and advocates.
Well, I mean, and also to add, I mean, there's power behind the personal testimonies because it's a way of destigmatizing, again, what HIV/AIDS is about. It's about showing that this is not about someone else being impacted. This is about my family members. This is about our community. This is about our neighbors. These are individuals that we live among. you know. So it's really a way of destigmatizing it and continuing to really add that personal touch so that people really understand the issue.
The National Black Leadership Commission on AIDS have affiliates in 11 cities across the country. And we're certainly in those areas where we see high incidence and prevalence of AIDS: Washington, D.C., Atlanta, Georgia, Tampa, Florida, Detroit, Michigan, Baltimore, Maryland, and 6 cities throughout the state of New York. So beginning where we have affiliates, we will begin the campaign, and we're also working with the National Baptist Convention, where they have, of course, faith leaders throughout the country, to get them to be a part of this, as well as partners with a number of civic and fraternal organizations, sororities, fraternities, and others. Yes, sir.
Would you be able to talk more about the age-appropriate curriculum that you're proposing?
Yeah. You know, I believe that those who develop curriculums and those who work in health fields are in a position to be able to develop a curriculum that is more appropriate for a 6th grader and a 12th grader, to get the message across in terms of HIV, AIDS, and other sexually transmitted diseases. As I mentioned, the data in the report show that young people as young as 13 are showing increases in terms of the rates of sexually transmitted diseases. So developing a curriculum that would address that age group in a way that they understand it, certainly culturally appropriate, age appropriate, those who develop curriculums, those who teach health in schools, we're calling upon them to do just that. And so that's so that we have curriculums that can reach all levels of age groups, young, teenagers, and slightly older. Let's see if media, any more questions from media. Hi.
Good morning. I think this is absolutely wonderful. I work for a business in Harlem, and I'm also on the board of a gay pride organization that's based in Harlem. And I would love to be a part of this movement. I talk about
Deborah Levine, Vice President of Community Development.
Just one other thing.
From press.
You know, and that is, as you mentioned, this discrepancy with the HIV and AIDS numbers has existed, you know, basically since the beginning of the epidemic. Looks like over the years, obviously, these numbers have gotten even worse. So what kind of expectations do you have, about this initiative making a difference?
One of the expectations we have, again, is that we will be able to bring this back in the forefront of the public's eye. Because, as I mentioned earlier, there is a tremendous sense of complacency. People believe that the HIV/AIDS is no longer a problem until you start talking about the actual numbers, where the Center for Disease Control reports that annually there are approximately 56,000 new cases of HIV in this country. Now, most people don't focus on that. Partly we don't see it in the media every day. You recall probably back in the early 80s and into the 90s when people were shown to be dying, the emaciated bodies and so forth. So we don't see that now, and people just think, okay, it's no longer a problem. Or if they become infected, all they have to do is pop a pill and they will be cured. So we want to help people understand, number one, there is no cure for HIV, but it is preventable. And you help to get that message across through education, through engagement at the community level, faith-based organizations, community organizations, tenant association. Elected officials have powerful tools through their newsletters, town hall meetings, to talk about this and keep it in the forefront. And we're committed to doing that, to move us from complacency to at least knowing and understanding what is at stake now and get the information. Then we are encouraging people again to get tested so that they will know their status. 25% of the people do not know their status, so that if they are infected, hopefully they will get treatment and have an opportunity to at least maintain a healthier quality of life. So this is some of the impact. Greater engagement across the board at the community level, very active, going into our barbershops, into our hair salon, into our nail places, having our faith leaders to recommit in terms of dealing with the whole issue of stigma and discrimination, engaging more with public figures so that they too are continuing to talk about this. We have to do this. Thank you so much. Thank you.
You're welcome.
Thank you so much, and I'll be in touch.
Yes, because I would
Okay.
really.
Oh, yes, you got to do it. Yes, I'm sorry. We're finished with the media, so this is community now. Okay.
Dr. Fields, just want to say I want to thank you for being in the forefront. My name is Joseph Selman, and I have been living with HIV for 24 years. So we appreciate what your organization is doing to Reverend Butts. I would just want to let you know, as an organizer, community activist, I will be working with community leaders, the faith base, which I am doing now, and you have my support.
Thank you so much.
Thank you.
Face of HIV/AIDS, 24 years. Thank you. So much. And thank you, especially the press, for coming out today. Thank you guys so much. It's good to see everybody, and you always support. I know, you go let us know. Anticipate.
Joseph, if some of the folks that came would take a picture with Ms. Fields, we would appreciate that.
Okay.
Yes.
Mandela. Lynette, come into this photo, please. Represent your voice. Okay. Okay, so can you come and talk to me? Your organization, right? She's with them.
Ma'am, didn't I tell you to get up? No, ma'am. Come on. Thank you. Let's step over here. Oh, my God. I am not. It's on that side.
Any other organization? Why isn't he up here?
Who? George? Because he doesn't want to do. And I'm not going to force him, so I didn't ask him questions. Athena.
Councilman Cumberland's office is here. I didn't know that.
Come on, come on, come on.
Exactly. This is the commitment. This is the commitment.
You gonna do a video real quick so you can put the steps? A little video. 5, 4, 3.
30 years strong. We will win.
You okay back there?
So,
Okay. All right.
X-ray.
I'm sorry. I'm sorry, folks. Yeah, a little too long.
Maybe you need that?
Just a little tight on this side. I can't see you right here. Yeah, okay. I can see it. I can see it. Okay. Everyone say yes?
Yes.
Two more, please.
Yes.
So step forward. Let's see. Bring your man right there so I can see it. He's good. He's good.
I can stop there.
No, no.
Thank you so much. Thank you. This is the team that's gonna make all this work out. That was already fine. You know what this week is? I say what is gonna happen. Premiere. She's so funny.
Yeah, I can move over. You good?
I'm good.
What do you think is
All right, thank you guys. You did an excellent job. I think you did a really good, actually.
Tell me when you're ready to go. Let us both start. Excuse me. Let's start by getting your first and last name and spell them for us.
Yes, Joseph Selman, S-E-L-L-M-A-N.
Okay. Mr. Selman, we all just had this, or participated in this press conference, got some enlightenment, but I was surprised to hear you speak out at the end of the press conference, and you said you had some personal interest vested in this topic. Please tell me again what you said about your experience with HIV and AIDS.
Yes, I'm a person who's been living with the HIV virus for the past 24 years. I'm here today to give my support to Dr. Fields, to Reverend Butts, the chairman of the board of the National Black Leadership Commission on AIDS. I feel it's very important for me to be speaking out. The stigma that surrounds this disease is unbelievable. By my coming forward, this will allow someone else who is newly infected to perhaps go and seek some medicines that will help to save their lives.
In your experience with living with HIV for 24 years, what have been some of the biggest challenges? What do you think should be focused on for African Americans in general and prevention?
Well, the issue of homophobia. I'm a black man living with the HIV. I'm also a gay person. I have never in the past been able to say that publicly. In fact, this is the first time I'm saying it publicly now. But not only that, the stigma of HIV must be arrested. And I very much support Dr. Fields in this year-long campaign. I will go on the website and tell my story.
And And as you as you go day-to-day life living with HIV, what do you think? What's missing? Why do you think our numbers are so high, and why do you think the African American communities of color aren't getting this message?
Well, it's not that we are not getting the message. It's several folds. I mean, funding is one of the issues, but we need to have we need to go in the community and let it be known that this is an issue that's detriment to our community, to the lives, especially the Black and Latino people of color. That is key, and we are not getting the proper service in those communities that is most hard hit. In New York, Bed-Stuy, the South Bronx. You see, while I have access and I'm not on a waiting list, we are blessed in New York, but around the country, ADAP, there are so many thousands who are waiting. And this is what this campaign that Dr. Fields had spoke about, and she certainly have my support.
Yeah, you know, the AIDS epidemic was kind of first recognized about 30 years ago, and on the one hand, it's much more prevalent, it's much more visible, and people are more and more aware of it, but at the same time, the numbers are only getting higher. Could you make a comment on this?
Well, there's a number of reasons, and I think that our president speaks to that. The National AIDS Policy is going to be a big support for those numbers, those increasing numbers. It's also about housing. It's also having access to affordable health care. You know, these are the issues that the National AIDS Policy is addressing. President Obama has addressed that, and after years there was no National AIDS Policy. So housing is one, access to care. It's a whole host of things. It's not just HIV, why the numbers are going up. There's other issues that needs to be explored.
So you like Obama's national plan for AIDS?
Well, it's a start. It's about trickling down to the communities, and those communities where the funding should go. In other words, the funding should follow the epidemic.
How do you feel about the way that the epidemic has been treated in a big city like New York versus more or less urban communities? Or have you been aware of differences in how things are being carried out?
Well, in New York alone, it depends on what zip code you are. You know, what community, as to whether you're going to get that service. And I'm hoping it's going to be, funding will be given to the communities where it's needed the most. And we'll see how that pans out.
Just to clarify, would you be able to mention a few of the communities that you think it's needed the most in?
Well, certainly Bed-Stuy. We had a co-chair from the Black and Latino Asian Caucus. You know, those are here in Brooklyn, Central Harlem, you know, East Harlem. You know. Thank you then.
Perfect. Thank you so much.
All right.
Thanks a lot. I really appreciate it.
Thank you.